Hello, this is Tim with Tim's Trach Talk. The reason I'm setting up this YouTube video and channel is to spread awareness for tracheostomy patients and anybody going into a tracheotomy, maybe had a tracheotomy, family members from a tracheotomy, all different aspects. I feel that there's not enough awareness out there for people going through this. Me, I had a tracheostomy September 2019 due to a sleeping disorder. I stopped sleeping or breathing 131 times an hour. Sleep eating, night terror disorder, um, which caused me to have a lot of issues. Narcolepsy, um, added weight gain. I've gained 87 pounds over the last 15 months. So there's a lot of different things. I know a lot of people have different issues. I'm not trying to minimize that. But what I'm just trying to do is spread awareness because I went into getting the trach without any knowledge at all other than what I saw online and any questions I might have had for my doctor. I want to apologize offhand for any kind of coughing that I do. Um, this is a little bit different trach. I do have a metal trach. It's a Jefferson metal trach. It's cuffless, so I'm able to speak with the passing mirror. I don't have to um, blow it up to speak and unflate it to or deflate it to have everything going properly. It's a little bit thicker than other people's. This is my third different trach that I've had put in due to complications. The curvatures and everything just weren't correct. I've had the regular Shiley one, I've had disposables, and now I finally have a metal trach. The difference is that I have it for sleeping disorder. So I have to have one that I can uncap thicker that I sleep with at night. Um, this is just like everybody else's trach that has one now, um, except for well, I'll explain that there's a lot of differences between each different trach. I'm not a doctor. I'm not a medical professional. All this though is documented with my doctors and my home care and my healthcare professionals. Um, the channel that I'm going to be doing is going to be try to be weekly. I'm going to try to explain a lot of different things in each video that's going to kind of progress as I've gone through this. A lot of stuff I'm speaking about is just going to be off the mind. As I speak, a lot of the stuff is written down where I can speak about things. Um, but the ultimate goal is awareness. So that's the first thing I would like to talk about is when you go into the doctors for the first time, knowing that you're going to get a trach. For me, it came as a complete shock. I thought that I was going in to talk about something after CPAP because CPAP did not work for me, BiPAP did not work for me. Um, so I thought I was going in for something else. The doctor explained to me that I had 6 months to live if I did not receive a trach. So it kind of was a no-brain situation. Um, it's scary at first. You have to understand that this is a life change, but this is part of you now. So you need to adapt to it. The questions that I had did not even come close to the questions that I had after the trach. I don't think anybody can prepare you for it because everybody's bodies are different. Um, Me personally, I did not have a lot of issues um, with secretions, with plugs, with just overall comfort. I healed very well from it. I was in and out of the hospital in 4 days, um, and my life completely drastically got better. My heart rate was my blood pressure was 195 over 105. My standing heart rate was at 166. I was on the brink, I was a walking bomb. Uh, Now it's 126 over 60, standing heart rate's at 112. Everything has just seemed better. I'm not sleeping um, bad anymore. So, with that being said, everything is starting to get better, other than the fact that I have a trach. The questions that I would love to answer for anybody, especially going into the trach, are something you have to experience. You can't go into a trach knowing what it's going to feel like to have a tube in your throat. Um, the comfort levels, how it looks. For me, PTSD has been an issue of people staring, secretions kind of coming out and not knowing that they're coming out, my trach falling out, the intercannules falling out, and nobody saying anything. This is a clear passing mirror. Most of them that they will get for you are purple. So it's very awkward. Also, this whole setup here is something that I've had to create. The supply companies will not provide the same exact things that you get from the hospital. So that is a big concern as well. But let me just go backwards and talk about the whole process going to get the trach. I'm not sure what kind of trach you're going to get. I don't know what kind you're going to get. Cuffed, cuffless, metal, disposable, plastic. In future videos, I will show you the different types of trachs. I will show you the different types of suctions, the different types of humidifiers. I have a ton of supplies. My insurance company has been great about that. What you need to do, especially during the trach process, is you need to find a correct supply company. For me, I have multiple supply companies. I have 3 right now because you can't have enough people trying to help you. Once you're out of the hospital from the trach, it's really hard for people to want to do things for you. You're kind of left on your own to find supplies, to get the help that you need. My doctor is 2 hours away, so for me to go to the doctor that did this is a very difficult situation. Use your insurance to the best of the ability that you have. If you can get more supplies than they call for, do it. If you get auto ship, use it. If not, which one of my companies does not have auto ship, I literally have to call every single month. They will not call me, and I have to itemize everything that I want, everything that I need, and place orders that way. So there's a lot of different situations that are very, very tough. I would love to hear anybody's comments about different supply companies, or if anybody wants to know who the supply companies I use are, I would love to tell you. I also would love to answer any questions that you might have about going into the trach first. If you have other questions, that would be great. Or any other comments, that would be great. Again, every week I'm going to try to do a little something different to show everybody about the trach. Cleaning cannules, different types of supplies, different types of collars, gauze pads, shower supplies, cleaning supplies, the setup that I have for all my supplies, every day, the bag that I bring with me 24 hours a day. Um, just just like my doctor told me and the nurses told me, don't underestimate how important it is to take care of this and to do what you're supposed to do with this. Do not take any shortcuts with it. Shortcuts are going to hurt you in the long run. I promise you. I've had multiple infections already in 2 months with this. I have an incredible support staff of people that can answer any questions that I may have. I have incredible supply companies now. It took a long time, and I have the time and the resources to do this kind of thing. For those who don't, this is what it's for. This is what this channel is for. This is so you guys can get help and awareness to do certain things to take care of this trach. A lot of people have trachs for a short period of time. A lot of people are getting it later in life. I'm an anomaly. I'm younger. The doctor told me I was the Powerball winner of trachs, that this just doesn't happen to people my age. So this is going to be something that I'm going to be dealing with for, God willing, the next 50 years. So this is something that is a passion to my heart to help others with this. So please, I would like to hear from anybody. Just comment on my YouTube channel to, ask questions, comment, anything that you want. Again, I'm not a professional. This is the first thing I've ever done like this. First YouTube channel I've ever done like this. It's not going to be professionally made. It's just going to be me talking and going off a little script and doing all that. But I just hope that this can help somebody at some point. Because I wish that there was somebody out there who did this for me when I was going into my trach. Life goes on. The alternative is terrible. You do not want the alternative. If I have to live with this the rest of my life, other than, what the alternative was, I'll take this all day long. So I look forward to hearing from everybody, and take care, and hope all the best for anybody, and wish you all the best. Thank you so much. This is Tim's Trach Life. Talk to you later.